after our first speaker. Just a couple of announcements before we get started. Out of respect for our attendees and speakers, if everyone would please turn all your electronic devices to silent or vibrate or something that doesn't make noise. Restrooms, if you haven't found them already, are outside and to the right of the lobby. There's also restrooms upstairs for the breakout later this afternoon. And finally, just make a note of exits as you move around the building. Our focus for today is advocacy. We planned the day with the goals of improving your advocacy knowledge, skills, and abilities, and collectively enhancing our efforts at advocacy across the state. As I say, I'll provide some more details about PHACE and logistics for the afternoon, but first I want to, and I'm very pleased to introduce our first keynote speaker, Assemblywoman Shavonda Sumter. She graciously agreed to be here, but is also under a very tight time schedule because she has to get back to Trenton for hearings with regard to the minimum wage. And now I think everyone in the room will recognize that minimum wage is directly related to public health, especially when we consider underlying causes and social determinants of health. So in order to accommodate that, let me introduce Assemblywoman Sumter. She was elected to the New Jersey General Assembly on November 8th, 2011 to represent the 35th District of the state. She serves as the Assembly Majority Conference Leader, Vice Chair of the Labor Committee, and is a member of the Health and Senior Services and Law and Public Safety Committees. She is also the second Vice Chair of the New Jersey Legislative Black Caucus. Assemblywoman Sumter is a native of Paterson, but I heard this morning originally from South Carolina. And while in high school, she served as class president for her entire 4 years. It was during this time that her passion for public service was initiated, and upon graduation, she attended Kean University majoring in political science. She graduated in 1996 with a Bachelor of Arts degree, and during that time, she worked for Assemblyman Frank Cattaneo, Sr., who at the time served as Deputy Speaker of the New Jersey Assembly. This opportunity helped to broaden her understanding of the political process in our state and helped her to realize that the political process must be caring and compassionate about helping people. So I think we can learn a lot from her experiences. She received her MBA in Healthcare Administration from Fairleigh Dickinson University Silverman College of Business. She has sought to use her diverse talents and skills gained academically, professionally, and through community service to help improve the lives of people in various communities. She has served in a variety of capacities in health-related fields, currently serving as the Director of Behavioral Health Services at Hackensack Mountainside Hospital in Montclair. She's the recipient of numerous awards and citations as a community organizer, role model, and an agent of change, and she is a dedicated community servant. So please help me welcome Assemblywoman Sumter.
Good morning, everyone. Good morning. I want to thank you for having me here today. I want to thank God for great New Jersey traffic, so we were able to make it up here in record time. I am privileged to always stand before a group that's serving the public, and especially in healthcare, which is one of my passions. I actually have the privilege of working as a Director of Behavioral Health Services for a hospital, as well as serving on the Health and Senior Services Committee, Law and Public Safety, and Vice Chair of Labor. All of the issues that I am passionate about that I found are part of the social ills of society I'm able to work on from a policy perspective, which is important to me because oftentimes you find people who are working in elected offices who don't know the direct societal impact of the policies that they put in place. I call it the unintended consequences. You all are special people. Do you know why you're special people? Anyone know why you're special people? Because because you live in New Jersey, absolutely. That is special in and of itself. That's a commitment. But you are special people because you have access to people. You have access to data that can help change the public health outcomes of society. That is a special gift, a special talent, a resource that's invaluable. Do you agree with me? So what do we do with that information? It doesn't do you any good if it's sitting in a binder on a shelf or sitting in an electronic file on your computer. Am I wrong? How do we disseminate this complex information that sometimes you need a PhD to decipher? How do you convert it into information that a third grader can understand that funding is needed to support the initiatives? And before I go further, let me recognize my public health officer from the city of Paterson. So thank you for being here today. So oftentimes, as elected officials, your topics, your subject matters, your areas of interest are not exciting. We don't want to hear that there's not enough vaccinations. We do not want to hear that there's a possible meningitis epidemic. We do not want to hear what the air quality problems will have. We're now starting to talk about the impacts of lead, which you all have been talking about for decades. When I started out early on, I actually started with a faith-based organization who was surveying the community in the city of Paterson around lead abatement. And this was back in the 90s. So of course when it resurfaced as a result of Michigan, and we knew our levels were higher, I said, you know what, that's great. Don't care how we got there to this talking point, but we're here. And I embrace that. We now have a governor talking about making sure we're not shifting the funds, the $10 million that we allocate every year for lead abatement programs, to adding to that $10 million, because we have old housing stock. And the generational impact of that had not been discussed for years. So what else is a chronic issue that you all have the data for that we need to discuss? How many of you, if you can raise your hand, have met with your legislators? Great. And that's more than most people in different associations and organizations. Meeting with your legislators is critical because we're impacting the policy level change in allocating funds to support the initiatives that you all need to champion. Sometimes we only deal with the local level, and the local level has a finite amount of resources. And you rely on grants coming down from the federal government through the State Department to support your objectives. If you're lucky, you may get a small independent grant to support your objectives. And all of these are priorities, but it's how do we fund them and what's pressing today. You all have that talent in your day-to-day work that you do. So it's important that you work together cohesively because numbers speak volumes. So if you're saying there's a challenge, instead of saying it's 0.000 milliliters of a problem, let's break it down. 30,000 people in our surrounding community will be impacted if we don't address this issue. And then how do we address this issue? We address this issue by making sure that people come in for testing, making sure that we distribute information on awareness that's in multiple language, because that's the other dynamic that's happening now. When you're having these conversations, you have people who don't speak the language, and it's complicated information. So I started with saying make sure it's something that a third grade level person can understand, because it sort of sounds like the Charlie Brown teacher, wah, 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 right? because you're talking in terminology that is foreign. It's technical, it's correct, but it's foreign to a lay person. So making sure that we synthesize that information, that you work together cohesively to address the concerns, and pick 3 priorities for the year. I always connect with organizations and ask, what are your priorities? And if it can fit on one page, even better, because I can tell you, being a legislator is much harder than being in graduate school. As far as the amount of information, that's high-level information, that we need to receive, retain, and then filter out so we can come up with a policy that makes sense for the change that's relevant for today's time. Does that make sense to everyone? So how can we help you be effective? Now, I serve as a majority conference leader. Does that mean anything to anybody? That's fair. That's fair, because probably before I got involved in politics, it didn't mean much to me either. Okay, you have a title. A lot of folks have titles. You're directors, right? You're mayors and all of those things. But it means I'm one of 4 persons in leadership and a 51-member Democratic caucus that can set the agenda for the legislature. Now, that's power. So it means I can say, hey, this is a priority, i.e. lead, i.e. dealing with the heroin epidemic and making sure that Narcan's available to help revive people. But we did that, and I just want to bookmark there for a moment, because one of the things that I'm working on and I'm passionate about is we said, okay, we're going to provide an 800 number for people to access where rehabilitation facilities are, but there's no beds available. So now you raise your hand and you say, I want to get help for treatment, and there's no place for you to go. That's demoralizing. It leads to people staying out there in the streets and continuing to use illicit substances. We know that heroin costs $4, and it's pure. So how are we addressing these issues? So we're reviving them, and then we're saying, okay, good luck to you. You're now healed. Doesn't work. So we need another piece to it. And that's going to require money. It's going to require bed availability, which substance abuse is an exclusionary criteria for inpatient psychiatric stay. And most folks do not know that. Most legislators do not know that. And I sort of bang my head stating that. So I'm looking for residential treatment level beds to be available across the state. So instead of we're saying, okay, we revived you, someone's going to come and talk to you about your rehab options and there's nothing available. Hey, here's a bed available for you if you're willing to go into treatment. Here's a program you can go to in the state of New Jersey that's not going to cost your parents their home. That's the other reality. So I need you all to talk to us. If you haven't met your legislators, I want you to make a commitment today to see your legislators and to tell them what's a priority for the towns that you serve in. And the information that you have and the data that you have of what's coming down the pike. We always say the CDC, Center for Disease Control, says this, says that. Surgeon General says this, says that. What does it mean at home? If you can localize that message, trust me, you will have more impact. And just take that small step. I know you're all busy. I know you're all overworked. And trust me, whenever I hear my bio read, I say, what is wrong with me? I'm an overachiever. I sort of need to stop. But the reality is, while I can, I will. When I can't, I won't. So I need you all in the time that I can to partner with me, to talk to my peers in your respective communities. I'm on the internet. Shoot me an email and say, hey, I reached out to my legislator, but I want you to synthesize it. I want you to pick 1 to 3 topics that's important to you, put it on paper. If it don't fit on one sheet, then it's too much. They don't need a dissertation. That's for you to know you're the expert witness, and see if you can parlay that into a policy change that will work. And sometimes it's one small word. that will work to help you create better health outcomes for our public sector. I'm available to you for the next few minutes. We are talking about minimum wage, raising it to $15 over a 5-year period. So it's not something that will happen immediately once it's passed into law. There are 80 members of the General Assembly. This past November, we were successful in having 51 Democrats elected, the first time since 1978 that you have 51 Democrats elected to the General Assembly. There's 40 members of the Senate, if you did not know that. There's 40 districts in the state of New Jersey. We all have to work together in order for a bill to get sent to the governor's desk. Once it's sent to the governor's desk, you also play another role in making sure that it's signed, because we have competing issues when legislation is going to the governor's desk. It's also great to have bipartisan support, and I do believe that health is one of those areas that does not choose a party. It doesn't say Republicans will get this disease and Democrats will get this disease, right? It crosses all lines. So however and whatever the issue is that you can walk away from here with today saying that I'm going to work on and I want to spearhead this, I recommend that you put together an executive committee, if you do not have one, to have that discussion, and you at least present a position paper as well as an organization to the legislative body as a whole. I'm available for any questions right now if you have any. Yes? We're set up a little differently. For me, I am the expert on healthcare for my office because I've worked in healthcare for over 15 years, and that's my training and specialty. We also have a committee liaison. His name is Brian Quigley, and he's in the Assembly Majority Office. He serves at the pleasure of the Speaker, however, very knowledgeable. And any topic you want to talk about, you think of, you can run it by him to see if, one, there is legislation that impacts that, two, if it would be an administrative change or a legislative change, three, if it's a change that you know should be made so it's more effective. We love to have those discussions. You're welcome. Anyone else? Yes, sir.
So with your background and knowledge in healthcare, do you use that, or is that recognized by other legislators? I mean, will you be able to tell them, I do know something about this subject, or will they seek you out?
Combination of the two. We're sought out for our respective fields. That's the great thing about the legislature. At one point in time in history, the legislature, because it's a lawmaking body, was primarily lawyers. And at this point in time, it's every sphere of sector of employment you can think of. And if you're an expert in that area, your peers as legislators seek you out, or either industries seek you out. The other piece is, if you are not an expert, like I'm on law and public safety, I know how it impacts the healthcare sphere, but I've never been a police officer. However, you have experts who come before you, which you all are, for hearings on different pieces of legislation, and they share their expertise. And we value that. That is the great thing about the democratic process in the state of New Jersey, where we're valuing your opinion. And unfortunately, people don't come before the state enough for committee meetings because you all work. But you do have representatives who can bring your issues and positions to the state. You also at any time can request to meet with your legislators in your home district to present information. And that's why I say synthesize it into a one-pager so it's understandable by a third grader, and then you get a piece of legislation in play. Yes?
We've got a challenge coming up this summer with the Zika virus.
Yes.
And I know that the House has passed a bill last night giving some money to the states. How do you see our state legislature kind of helping us with that?
Sure. We passed a resolution last week in the Health Committee, Health and Senior Services Committee, one recognizing and listing the Zika virus and encouraging the federal government to act. That's the other thing that we can do. Our challenge is what's federal, what's state, and then what's local. So when we know it's something that's a bigger crisis, a national crisis, we look to our federal government and we send resolutions to our congressional delegation, encouraging them to act so that way we can apply for funds to support awareness. And I know we've seen a ton of advertisement around it, but to look.
Our first annual statewide meeting right in this room in partnership with a lot of other organizations, including the State Health Department. And then from 2008 until 2015, spits and spurts, we did some things, but it was irregular. Over the past year, following a meeting of the leadership with the State Health Commissioner last summer, we've been meeting on a regular basis, and one of the outcomes of that effort is today's event, really finding a way to bring all of our associations together to work together on any number of topics, but with our focus today being on advocacy. The mission of PHACE is to provide a forum wherein all public health disciplines are equally represented by way of the leadership of the recognized New Jersey Public Health Associations to foster a single voice and face for the advancement of public health in New Jersey. And what I'd like to do is just name the organizations that are involved in PHACE and ask the leadership, including the president and the PHACE representatives, to just stand so you have a sense of who in the room is actively involved in this right now. So New Jersey Society for Public Health Education, New Jersey Public Health Association, New Jersey Local Boards of Health Association, nobody's standing up, New Jersey Environmental Health Association, New Jersey Association of Public Health Nurse Administrators, and New Jersey Association of County and City Health Officials. So the 6 organizations, their presidents, PHACE representatives, leadership working together on a regular basis to move things forward. Thank you very much. In addition, while not a, quote, member of PHACE, we do have liaison from the State Health Department, Office of Local Public Health, in Michael Lackett, who works with us to keep those lines of communication open between our organizations and the State Health Department. Maybe more importantly, at least for today, I want to recognize the individuals who put the most effort into making today happen. Megan Avalon, Shireen Knockby, Elizabeth Brewer, Bob Urich, Laura Stanzelis O'Reilly, Rose Jean-Baptiste, and Linda Brown, all on the planning committee, all working very hard over a number of months to get the speakers and put today's event together. So if we can have a round of applause for those individuals. And then finally, a shout out to the University of Wisconsin Population Health Institute, which some of you will know is the home of the county health rankings and roadmaps, although we tend to only talk about the county health rankings. They provided a grant to us in order to support this event financially, so thanks to them and to our local coach from the county health rankings, Tony Lewis, who I saw earlier, but there she is sitting way in the back. So Tony representing them, but also helping us with speakers and some of the organization of today's activities. So we wanted to bring together interested parties in an environment of sharing, collaboration, to foster a movement forward around advocacy. Assemblywoman raised one of the issues that at least our association, the health officials, is working on very actively right now. I know Dave Henry has been talking about it for months, along with some of the others, the lead issues that are here. But there are many others. And so hopefully we can, through our morning panels and the breakouts this afternoon, start to bring together our voice collectively across the state to move some of these agendas forward. Just want to shout out 3 very current issues, both locally and nationally. Zika was raised already. The House in Washington approved $660 million, I think was the number yesterday, for supplemental funding. But be careful about how we understand what people are saying, because as it turns out, that $660 million is not additional funding. It's a shell game of moving dollars around. And so it's actually being taken from the emergency preparedness and Ebola dollars to fund Zika. So taking from Peter to pay Paul, if you will. The White House had requested $1.9 billion in additional funding to address Zika. The Senate approved $1.1 billion of additional funding. So there's this clear disconnect, and it's through our collective efforts speaking to individuals and making them understand the needs and the realities, as the Assemblywoman explained, that hopefully we can find some common ground and get the resources that are necessary to address all of our public health issues. So that's just one, very current, happening yesterday and today, presumably. The lead issues across the country and in New Jersey, with the potential lowering of the standard from 10 micrograms per deciliter to 5 micrograms per deciliter. Clearly a good public health move, but where are the resources to support all the additional work that will come with that change in the standards? Not necessarily doubling, but maybe tripling or even more the number of individuals that have to be addressed, the number of environmental conditions that have to be cleaned and abated. And then there's changes across the state potentially that we're hearing about with regard to efforts around sexually transmitted disease investigations and follow-up. And how do we, as the public health community, understand what those potential changes are and assure that we address those changes so that it's equitable across the state, both for those who are doing the work, but even more importantly for the residents across the state. So just three very current, very active examples of how we hopefully can take the information we learned today and translate that into a collective effort to address those issues. And so those are my three examples, and what I'd like to do now is to bring up a representative from each of the PHACE organizations to give you just about a 2 or 3 minute presentation each on those organizations' activities in hopes that we hear some common ground there. And so I'll ask them to come up, have a seat, and we'll hear from each of them and hopefully have a couple of minutes for questions and maybe discussion. From New Jersey Association of County and City Health Officials, our President, Trevor Weigel. New Jersey Association of Public Health Nurse Administrators, Debbie Gash. Co-President, New Jersey Environmental Health Association, Bob Urich, current President. New Jersey Local Boards of Health Association, Laura O'Reilly is the President. There she is. New Jersey Public Health Association, Elizabeth Brewer, who is their advocacy chair, and New Jersey Society of Public Health Educators, Candace Davenport, president-elect. And so I'll just ask each of them to cycle through. There's a, or you can come up, whichever way you want.
Thank you, Kevin. Good morning, everyone. As Kevin said, I'm Trevor Weigel, the president of the New Jersey Association of County and City Health Officials. I'd be remiss also if I did not thank those who helped put this program together today. It's good to see all of our professional and specific profession, environmental, nursing, et cetera, professional associations come together in this way. And advocacy is a great place to start. It's something that we can and all should be doing together. You know, the saying, one message, many voices. I got it right that time. Usually I say many messages, one voice, but. So anyway, New Jersey Association of City and County Health Officials and Advocacy, where we've been, where we're going, and where we are now. I have less than 5 minutes, so the abridged version. As long as I've been a member of the association, we have done advocacy. Can you say done advocacy? We've advocated. We've had a legislative committee whose responsibility has been to research pending and newly introduced legislation, form a preliminary opinion about it, come back to our executive committee, present that, and we would then, as a committee, decide if we wanted to do something with that, what we wanted to do, and how we would do that. And we've been doing this for many years. It's a lot of hard work, and I take nothing from those individuals who do it. We also even, I think for maybe a 10-year period, had hired professional lobbyists, different ones, over, I think it was about a 10-year period, to help us do this. And then, I guess about probably two budget cycles ago, we decided to part ways with our lobbyists. It had nothing to do with the lobbyists. They were doing a good job. It was really an economic decision, and we decided our resources would be spent better elsewhere. And I kind of see this as the impetus of where we have been going and where we are now. As one of my colleagues would say, the stars are aligning, and I think this was the first dim star in the sky. So we parted ways with our consultant, and around the same time we started working on what we called a vision statement. Not a vision, a vision, what we call a vision story, not a vision statement, because that would be short and sweet, healthy people in a healthy community, and that isn't good enough for us. So we labored over a vision story, and I feel like I should be wearing sandals, but that's an inside joke for 2 or 3 people. And around the same time, we also started, we took a look at our mission and kind of revised that. And then, because strategic planning was the big thing to be doing then and now, we started creating a strategic plan around that revised mission and that new vision. And really, we didn't want a big, lengthy document that sat on the shelf, so we created what we called a strategic map. And that is a one-page, simple, actionable document. It's right here. And it has 3 strategic priorities, each with one goal and each with several objectives. And you're saying, where are you going, Trevor? This is about advocacy. Well, one of those strategic priorities is advocacy as a hallmark of our accomplishments. And our goal there was to influence the future of public health in New Jersey, and our objectives were to annually produce 2 policy positions addressing current public health issues, distribute 2 policy positions per year to appropriate audiences, and by the end of next month, June 2016, increase the number of encounters with legislators and other partners by 10%. So also around the same time, we were looking at what our committees do, and we're trying to reinvent our committees. So we turned them into work groups, and we have committees that focus on the major areas: communicable disease, chronic disease, maternal and child health. We have one on membership, advertising, and environmental, and one public health emergency preparedness, I think I said. So we kind of revamped what they were doing. And because we decided we were going to come up with 2 position papers, it was perfect timing. We decided that each of these work groups would meet at our 5 programs a year, carve out a piece of time, and they would work together as a group. So what their first task was to come up with their own kind of SOP, what they're all about, and to start working on policy positions. We have, I think, at least 2 recently. We have one on funding. We have one on lead. So what have we been doing recently? Well, we've been working on lead, tobacco, and funding. I think those are the big 3 issues we're working on. So we have met with legislators, we've sent emails, we have written letters, and we've testified in front of committees for these 3 issues. Some we've done all 3, some we've done 1 or 2. Tobacco, we have supported the ban of flavored e-cigarettes. We've supported the increase of the smoking age, purchasing of tobacco products, I guess, to 21. And we've supported, I think, eliminating e-cigarettes from pharmacies. In funding, we have met with a legislator to get public health priority funding put back into the state budget. We were asking for $5 million. When it went away a few years ago, finally, it was just over $2 million. I think its heyday, it was between $10 and $12 million. We then, after meeting with that assemblyman, we went to Trenton to testify in front of the Assembly Budget Committee to, again, ask for that money, and we're still working on that. And finally, in lead, well, that's all we're talking about today. Well, no, it's not. We're talking about Zika and other stuff, and STDs. But obviously, this is really more about resources than it is about lead. We support reducing the childhood lead, the pico, micro, whatever things they are, from 10 to 5. But we, as Kevin pointed out, we can't increase the amount of work we're doing by 3 to 6 times without funding. So we're advocating for funding to do that. But again, we obviously support reducing the lead level. And we're trying to not just, we don't want talking to legislators to be the only advocacy we're doing. We want to reach out to the public too. The lead presented us the opportunity to get invited by Gannett newspapers to do an interview, which they published in, I don't know what all papers they have. I think the Courier News in South Jersey, the Asbury Park Press, but we did an interview with the editor, and we gave us an opportunity to talk about lead, to clear up some of the misconceptions over
In the office, and anybody that you're interacting with in terms of advocacy, they could be potential decision makers down the line. And so, like I say, I keep saying your boots on the ground. You are experts. You are expert at what is happening in your community. You are an expert in your field, and you have knowledge that is not heard at the federal level. So people want to hear not only your knowledge, but your stories. They want to know how this $1 million budget proposal, what does this mean on the ground? What does this mean in my district? What does this mean in my state? So you can be confident when you walk into your meeting because you are that expert. And then you're going to plan your message. We're going to be clear. We're going to be concise. We're going to maybe ask some questions to see what the individual we're advocating, where are they coming from? Do they have no familiarity about what public health is and really just think it's a flu shot and that's it? Do they have a family member who has worked at a health department or an environmental health department? Or have they actually done research and they're very knowledgeable on what's happening? Even if they're at that far end of the spectrum, you still have valuable information to supply them with, and you have information that they can then go and use to advocate on your behalf. And so it's all about training the trainer, training advocates. You're going to become an advocate. You can advocate for people to advocate for you. And the members of Congress, they ultimately have to go advocate on your behalf in order to get policies passed. And so once you've kind of figured all of that out, you're going to make sure there's actually something actionable. You're going to answer the question, so what? Why does this person care? And so if there isn't something that they can actually do, you're not really doing advocacy. So if you're talking about, you go into a meeting with your member of Congress and you bring in a 300-page report about all this great statistics, and by the time you're done talking, you don't actually get to the so what. You're just talking about, we have a confidence in all of this, and this is how it's changed from this year to that year. You have to be very clear, you have to be concise, but you really need to answer the question, so what? Because people want to help you. People want to know what they can do to help you. So answer the question for them. You're going to practice your message. You're going to double check the technical jargon. Are you using words like social determinants of health? Health in all policies? CDC, HRSA, EPA. Are you using those words? Even using the word epidemiologist, you can get deer in the headlight looks. And then you have to wait 10 seconds for them to go through the Rolodex of the dictionary in their head to figure out what that word means to continue talking, because otherwise you're going to pause your advocacy efforts and they're going to miss everything you say for the next 10, 20 seconds. So just double check that you're being very clear and concise. And it's great to have the data, but it's great to have a story to go with the data. And the key is to make yourself memorable. Come up with a story about how this actually is affecting people in a real way. Making the data come alive is really one of the assets that you can bring. And so my next slide is just a reminder. If I can get to it here. Oh, no. I'm going to Okay, we'll try again. So the next slide is just a reminder that, oh no. It's stuck here. That's not good. From current slide. Okay, so we'll move on. Is there a clicker? Okay. Well, good. Now I can walk a little bit. Stay close to the mic. But just remember that advocacy, right, it also can be in forms where you're not sitting and talking to people. And so when you're writing a letter, you're going to want to make sure to apply some of the same principles. Getting to the point quickly. What's the so what? How can they help you? Supporting that so what with some research. Throw in a very small story, and, you can send your message out to the world. And so now a little bit of 101. Just a quick reminder, 3 branches of government. So we have Congress, which is made up of the House and the Senate. And the House has 435 members. The Senate has 100. And so every year they have to pass a budget. And so every year we are in the middle of an appropriations process. And so right now the President has already released his budget for the next fiscal year, which is 2017. And Congress is still marking up the bill. Since it is an election year, which elections, again, they happen every 2 years. Right now, with the presidential election, a third of the House, a third of the Senate, and the whole House running, it's a great time to reach out and talk to people because they want your vote. They want to say how they are actually doing something for their constituents. It's a great time to get people on record on things. And so just keep that in mind as August comes around, when people are starting to do town hall events or going to parades. If you are having some sort of event happening in late summer, early fall, invite your member of Congress, invite your assembly person to come visit and take part. Great photo opportunities and some of the things that can equal easy wins for them to show that they're supportive of public health. And so just a reminder, you can do advocacy within the White House, within every single agency. If you happen to have relationships within agencies, you can, ask people, why aren't we getting this money? And maybe there's something that they can do. Maybe there's money that can cobble together. Maybe you can become the 17th state that ends up being able to have wellness programs for people with developmental disabilities. There are ways that you can get around Congress because we know they get so much done that they don't. So you'll be successful in doing federal advocacy in some unique ways. Also, third branch of government, judiciary, and as you can see, even having another justice fill out the Supreme Court is turning into a partisan issue. But like I said, appropriations. So there's 2 main ways the government gives out money. There's mandatory funding and discretionary funding. So at NECHO, we focus mostly on discretionary funding and reminding members of Congress that public health is a thing. That's a thing that needs to get funded every single year. And so we focus our efforts on one of the 12 appropriations subcommittees, which is the Labor, Health, and Human Services and Education Subcommittee. And so this is the subcommittee on appropriations, where these are the people you really want to cultivate. With New Jersey, you all don't have anyone on that subcommittee, but you do have a member of Congress who sits on the full appropriations subcommittee, full appropriations committee. And just to let you know, as far as timeline goes, if this was Schoolhouse Rock and I was singing I'm Just a Bill, the President's budget should come out February 1st, or the first Monday in February. Next year, since we'll have a new president, we may see a budget in March, April. I wouldn't be surprised if one comes out in the middle of April. It just means that getting Congress to pass a budget by October 1st and avoiding a federal shutdown could be fun for all of us. And so we have to go through this process every single year. And so right now with Zika, right, we're asking for emergency supplemental funding. So this would be new money that's just taken from the federal reserves and wouldn't be paid for through taking it from other programs. Right now, the President and the White House, they've shifted funding in a couple programs, including emergency preparedness, which if an emergency supplemental doesn't go through by July 1st, New Jersey will lose 8.4% of your preparedness dollars. Yeah, so it's a little over $1 million. It's a lot of money, and one of the things that we're hearing, because as you can imagine, we're up there with all the partners of all of the state chapters, we're up there with the national chapters, and everyone else you can think of pushing for this money. And one of the main things we're hearing from is, oh, we haven't heard anything from our constituents. We haven't heard anything from the public health community. And particularly people in the northern states, they're going, well, why should we care? We're not going to be affected with it because we know diseases stop just at the state line. Nobody travels. Quite frankly, people do not understand how diseases work. So you have to be very clear and concise and remind them that, yes, this is in our national security, our national interest, our state interest, the constituent interest to tackle these issues. And so, like I said, so this is New Jersey. You have 6 members of Congress that are Republican, 7 members of Congress that are Democrat. All of them are up for election this year, every single one of them. In the Senate, your senators, neither of them are up for election, but it's still great to reach out to both of them. And, between Frank Pallone, who is a really big public health champion, we could turn him into a better public health champion. You can invite him to join the Public Health Caucus if you're one of his constituents. But, just start thinking of ways that you can potentially reach out to them come August. And so these are some of the ways. You can invite them to come visit your health department, come to an event. You can visit their district office or one of their regional offices if they're a senator. Or if you happen to be in D.C., go to their office. Anybody can go. It's lovely. Usually they'll get an intern to come show you around. You can write letters, emails, calls, letters to the editor, harnessing social media so you can tweet at them. You can thank them for things because it's not always about what do I want, what do I want. You can actually thank them in a public way. And attend town hall meetings and try to get them on the record. And so one of the things that will get touched on in more detail, but just to remind everyone, there's varying degrees of outreach you can do with members of Congress. You can just educate them and provide them information. You can do advocacy, which is information with a bent, information answering that question, so what? Or you can do lobbying, which is I want you to vote yes on H.R. 2901. So if you're a little bit afraid of I don't want to talk to them because I don't want to lobby, there's a lot of things that you can do that are not lobbying where you can still make an impact. And so, also, why does this matter? The media actually does care. Public health. Look, Zika in the news in New Jersey. The Washington Post, the Senate reaches the Zika funding deal. So there's just a couple headlines. So public health is always in the news. When you're seeing things in the news, it's a great time to reach out to an office, shoot them a link to the headline and go, hey, I saw this topic. Just wanted to let you know how this is affecting us, in our county. And so remember, less is more. You're going to tailor to your audience. Try to be memorable. Keep your stories local. And make sure you're answering that so what. And so I'll give you just a second. Imperative, innovative, and effective injury and violence prevention programs work to prevent premature deaths, particularly among vulnerable populations of children, young families, and older adults. Do you think that's an effective message? Why? Okay. And so here's a similar message that tries to get at the same thing, but uses different words. So individuals can live healthier, safer, and more fulfilling lives by taking steps to protect themselves from injuries and prevent violence from occurring. Simpler words, still probably a little bit wordier than I would like, but, you know, you can see it gets the same message across. And speaking of messaging, for those of you who are a part of a health department, NACHO does have a messaging guide where we have tons of chapters of different public health issues that we've written talking points for and provided stories that all of you all can use as a launch pad for your own messages. I have a couple of those, your business card, and a consent page IRS form that needs to be filled out, but it is an option if you fall under that kind of restriction. Okay. So what are the restrictions for federal grantees? We have a grant from the CDC at my workplace. So the activities that we conduct under that grant, we have to make sure that we fall within these parameters. So the restrictions, the source of federal grantee restrictions are from the Consolidated Appropriations Act. I'm not going to read this entire thing to you, but suffice it to say that if you are a federal grantee, you can't prepare, distribute, or use a kit, pamphlet, booklet, publication, electronic communication. Basically, you can't publish or say anything to anybody in order to support or defeat the enactment of a piece of legislation. You can't pay the salary or the expenses out of the grant to any activity to influence the passage or the defeat of a piece of legislation, and you can't advocate or promote any proposed or pending or future federal or state piece of legislation. Very similar to the rules under the Internal Revenue Code. So what is prohibited for federal grantees? All direct and grassroots legislative lobbying is prohibited for federal grantees. There's no 5% rule under this restriction. It's all of it. Direct lobbying and grassroots lobbying is not allowed for federal grantees. Same rules as for nonprofits, just a little bit more restrictive. It applies to legislation pending in federal, state, or local legislative bodies. Lobbying on federal, state, or local level executive actions counts, but what is still okay? What do you not see up there? Judiciary, so you can still write amicus briefs. Okay, advocacy related to any proposed, pending, or future tax increase or regulation of a consumer product is also prohibited. So what's allowed? What can you do? If you work for a health department, you can do a lot. Health departments may work directly on policy-related issues and on policy implementation with other executive agencies. It's the executive exemption. The idea being that branches of government it behooves us all if they communicate with each other and work with each other and collaborate. And so there is an exemption for that. So, for example, a city health department can lobby another city agency. Nonpartisan policy research, study, or analysis, if it's a full and fair exposition, that's the language that's used in the law, you can do nonpartisan policy research and publish it. You can do an examination of broad social, economic, or health problems that don't refer to specific pieces of legislation and that don't contain a call to action, like we talked about a few slides ago. You can also respond to a request for technical assistance from a legislator. If a legislator contacts you and asks you for help, but that request from the legislator has to be in writing. It has to be from a committee or an entire legislative body. It can't be from a single legislator under the federal grantee rules. And the response has to be made available to all members of that body. So I said that I learned much of this from personal experience, and here's where I stumbled. So we are funded through Robert Wood Johnson Foundation. We are subject to these same restrictions on lobbying as if we were a federal grantee. And I was asked by a legislator in Connecticut who was writing a concussion law, a law to beef up their concussion law in Connecticut. And I happily went and testified. She asked me to come and testify on behalf of the bill. She was the bill sponsor. She was also the committee chair of the Children's Committee, which is where I went and testified. I was asked to testify as to what other states were doing and whether the provisions in this bill were similar to what other states out there were doing. And so that's what I do. That's my research. I research injury prevention laws around the country. And so I went and I said, you know, X number of states do this, which Connecticut is seeking to do. X number of states already do this. X number of states do this. Connecticut will, you know, this bill will bring Connecticut in line with what most of the other progressive states are doing in the area of youth sports concussions. On the top, because I thought I was being clever, it says, you know, testimony of so-and-so in favor of House Bill blah, 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 or in opposition to House Bill blah, 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 and I crossed it out with a Sharpie, and I wrote, to provide information to the committee on blah, 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 blah. I thought I was safe. I got in trouble. Why? Could I just yell it out? It's like, I don't want to do Socratic method. It was a specific bill. I could have gone to testify if what? Yes, if the entire committee, if I was invited by the entire committee. I wasn't. I was invited by the chair of the committee, which is not good enough under these rules. It has to be a letter from the entire committee inviting me to come and give my expert opinion. So, mea culpa, we had to use my vacation time to cover the time that I spent traveling to Connecticut, which is fine because it's a personal interest of mine too, and I'm passionate about public health work just like you are, so it's fine with me, but it's just, I'm a lawyer, and I should be ashamed of myself for violating lobbying restrictions. Anyway, so don't make the same mistake that I did. Oh, there's also, there's an exemption called self-defense. So if there's a bill that's being debated in the state legislature that affects your funding as an organization, for example, you can go and talk to a legislator or testify about that because it affects, you can do direct lobbying. You can't do grassroots lobbying. You can't say, hey, this bill is going to, you know, limit funding to my organization, so go talk to your legislature. You can go directly to your legislator and say, this is not good, this will shut down, you know, our organization. So that's called self-defense lobbying, and that's also an exemption. Okay. Oh, and you can educate the public. Was that, did I say that already? Yeah. Okay. Health departments can also work with the state legislature, city council, the board of selectmen, et cetera, any local organization that's part of the government, quasi-government, if it's part of the normal scope of your work. And this is called the executive legislative exemption. Non-government grantees may, upon formal written request, provide technical assistance to public officials, which is what we just talked about. You're also free to educate the public on areas that you work on a day-to-day basis. That's considered within the scope of your work. So really quickly on New Jersey, I actually have handouts with me that spell out the New Jersey lobbying restriction law. So if you want a copy of that, I can give it to you. It's a really good resource. Lobbying restrictions only apply to the use of federal grant dollars. Wait a minute. Did I miss a slide? I skipped one. I'm sorry. So again, the restrictions that we just talked about only apply to federal grant dollars. Okay, so if you're not funded by the federal government, you don't have to worry about those restrictions. Employees on federal grants can lobby if they're using other unrestricted funds. So I was under a restriction because we're funded by Robert Wood Johnson. If I wanted to go to Connecticut, I could have used my funds that I have under the University of Maryland because I have some funds there to do some work that includes lobbying. So if you have another source of funds, you can always do that advocacy or lobbying activity with those funds. So again, it doesn't mean you can't do it, just pay for it with another source and seek guidance. So, New Jersey, really quickly. So New Jersey law requires anyone who's paid or receives anything of value in excess of $100 in a 3-month period
and also is hired to influence New Jersey legislation, administrative rules, or government processes. And this is where New Jersey is a little bit more comprehensive than even the federal law, because federal law, like I said before, does not include administrative regulations or amicus briefs. Government processes arguably covers both of those things. So you'd really have to seek guidance and be careful about that. Government officials are probably exempt when you're operating within the scope of your job. There's a clear exemption in the New Jersey law for government officials operating in the context of their position. The New Jersey Center for Nonprofits has a really nice summary on their website, so I'd highly recommend that you visit that website and look at their summary of the New Jersey law. Okay, now the fun part. Let's do really quick scenario. During my breakout session, we're going to do some more case study kind of things. And so if you're questioning about whether you're allowed to do certain activities in the scope of your job, we can talk about them then. But scenario number one: may the local health officer whose salary to work on childhood obesity issues is covered by federal funds testify on a city council bill seeking to tax sugar-sweetened beverages about the health value of imposing such a tax. What do you think? Yes, you are correct. Yes, the health officer's testimony would fall under the normal and recognized executive-legislative relationship, right? We talked about that, the executive branch and the legislative branch and the judiciary, it behooves us all if they're speaking to each other and working in concert than if they're not allowed to speak to one another. So that's why that exemption exists, and so therefore that is perfectly acceptable conduct. The Board of Selectmen hold a public hearing to consider incorporating e-cigs into the town's smoke-free ordinance. May a local tobacco coalition that's funded with federal grant dollars inform the public about the hearing and urge people to attend if they're passionate about the issue? Yes, no? Okay. You're both right, because it depends. Notifying the public of a legislative hearing is not lobbying. So you can say, hey, public, you can publish something that says, hey, the Board of Selectmen is going to have a hearing on XYZ, and then remain quiet, not lobbying. That's fine. If, along with that, you include a call to action, that becomes lobbying. Okay? And then our last scenario, number 3, may a federally funded nonprofit organization accept an invitation from a city council to present research findings at an upcoming bill hearing? You are correct. So I guess the 30,000-foot talking really fast tutorial helps. Okay, so a research analysis does not constitute lobbying, as we talked about. The analysis can also include evidence of policy effectiveness, and it should include evidence of policy effectiveness. The nonprofit grantee must receive a formal written request to testify from the entire legislative body. Okay, and that's me. If you have any questions, I'd love to hear from you. And I went a little bit over, I'm sorry. Okay. This button?
Should be this button.
Oh, turn it around. It's a circle. What's my time frame, Kevin? Okay. Good morning. My name is Meryl Weitz, and I'm Director of Public Health Programs for a pretty large nonprofit down in South Jersey. It's lovely to be here, invited by Kevin, because my experience is sort of, we're going from A to Z here, in that my experience is on the program level, the service delivery level, but I have to say that tutorial on do's and don'ts was very helpful, because I think there are so many health educators and program specialists and directors of nonprofits who are unclear, on what is okay to do and not do. And I feel like so much of what we've said today is something that we do every day, and we're not communicating well and making that connection. I got so many ideas, even just sitting here thinking, gee, I write at least a success story a week for all my grants, and certainly that could be shared, with legislators and lobbyists and people who need to hear about what's happening on the ground. So thank you, Kevin, for the opportunity.
You know, Kevin knows me from my tobacco world, but I actually am very involved in lead poisoning as well, and I just want to, I have a perfect example of why program people and legislators and, people lobbying for issues need to communicate. I oversee the Southern Regional Childhood Lead Poisoning and Healthy Homes Coalition, and we, several years ago, did a program called Wipe Out Lead New Jersey, where we distributed lead dust wipe kits to pregnant women and families so they could test their homes as a screening. And that was in the days when there was money to do, inspections, abatement, etc. And recently, with the activity around lead poisoning, I was contacted with an opportunity for some funding. And they said, we never really stopped doing lead kits. We just do them on a very targeted basis where we know there's resources. And they said, guess what? We have money, you can do your lead kits again. And we did it statewide, and I think we probably gave out close to 80,000 kits over the length of the grant. And I said, okay, and what's going to happen once they find out it's positive? Is there any money for inspection, abatement, And they said, oh no, knowing about. So, the other thing, we advocate every day, we talk about, but even, lead screening, we pass the law, kids have to get screened, right? So a mother is given a slip. She's got 4 kids. They're with her because she has no daycare. She has no transportation, so she really doesn't understand because her kid's not sick. Why does she need to go get this blood test? The kid's going to cry. The other kids are going to get upset. Plus, she doesn't really know where to even go, right? Which is something we did a pilot project in Atlantic City that I'm going to talk about and really change the blood screening levels and increase them. But it was all about them being unclear where they were supposed to go. And when they got there, people were frustrated because here they had their kids with them and everything else. So it wasn't a real, it's great to pass the law, but unless clients understand what that law means and you make it easy for them to make health the easy choice and screening and protection the easy choice, it's not going to happen. Because in people who live in crisis, they're dealing with the immediate crisis of, where they're living and what they're eating and so forth. So it is important for us to be sensitive, when we develop these laws, that we communicate the information to clients in a way that resonates with them. And of course, we all have to work smarter, right? Do more with less, do more collaboration, do more with partnerships. But in all honesty, I think that's what has led us to sort of this combined meeting today, is those kinds of partnerships. We had to look at setting priorities. We didn't have enough money to do a whole state, so we had to look at areas that had the highest prevalence of smoking incidents in adult smoking, and that was 11 counties, 7 of which were in the South, right? In the South, you talk social determinants of health. I talk it all the time. Higher levels of unemployment, of poverty, decreased access to health care screening, therefore higher mortality rates of chronic disease. So that all, relates to those social determinants. My area of the funding is working with healthcare systems because the cooperative, or, in my world, we have relationships through maternal child health in hospitals, and we train physicians how to ask, advise, and refer to either the Quit Line or Mom's Quit Connection, which is our perinatal smoking cessation program. Then the other 2 areas that I've gotten funding for is a youth campaign and an ENDS camp. Everybody know what ENDS is? Who knows what ENDS is? Wow, see, you're going to love the next slides then. ENDS is electronic nicotine delivery systems, e-cigarettes. But it includes all kinds of delivery systems, because as you'll see, and you know what, I was with somebody yesterday who sent me a PowerPoint. She was a colleague who's a very renowned speaker, and she sent me a PowerPoint and said, and it was called My PowerPoint Sucks. And at 11:30 last night, I was changing my slides. So these are the ones some of these are the ones I put in. It's interesting. We got money for the South because we were able to demonstrate the higher incidence of disease in the South, okay? And there are people in the South, I always say the South, they struggle with a self-esteem problem because they're always last. They're the 21st, the 23rd. The smoking incidence was 25, 24%, where the rest of the state was, 15, 17. Well, Tony, I want to talk to you about the New Jersey rankings because they changed the research this year, and we're not allowed to compare years. But you got to look at the yellow here, where the smoking rate, which is always 25% in Salem, is actually now 19. Okay? And if you look in the areas of where there was dollars allocated, you see a change in the smoking rates from 2011, and there's a whole lot less change in the other counties. And what's also interesting is the highest now is 19, and the disparity between the South and the other counties has really, really shrunk. So that is a testament to that if money is targeted and, well spent, it can really make a difference. So that's my spiel, and I'm proud. So let's just talk about ends. I felt it was important because I go to these things and people don't know about electronic cigarettes. So I'm going to do a couple slides that just really, really quickly to talk about them. So e-cigarettes, smoking has declined significantly amongst teens especially, but it's tripled in e-cigarette use between 2013 and 14. I'm going to show you some pictures of these cigarettes. There's many generations of them. Generally, they're cartridges filled with nicotine, flavorings, chemicals, including formaldehyde. And nicotine and other chemicals are heated into a vapor, and that's why you see bubbles in my background slide, because that's the vapor, and that's what is sort of out in the air. So one of the big problems with these cigarettes is they're expensive, and people get cartridges, and they get liquid nicotine, and they refill them. But what happens when they run out of nicotine, or the cartridge blows up, or whatever it is, they wind up smoking a regular cigarette. So most adults, 73% or 76.8%, are actually what we call dual smokers, and meaning that they smoke both. But what e-cigarettes has done is given us an incredible opportunity, and that is to resurrect tobacco control in New Jersey, because it is so alarming, it's affecting our kids, it's normalizing smoking again. I just wanted to put this in there. It's not just a habit, it's a phenomenon, and I can't tell you how real this is. I mean, it is not just about, smoking or vaping. It's about, the cartridge you get and the flavors you choose. It's like going into an ice cream store and picking your flavors. They've really turned it into a cloud vaping contest at events, youth events. I mean, it's much more than just cigarettes could ever be, I think. So the first generation, I'm just going to show you pictures just so that you're more familiar, because I know a lot of people aren't. These are the first, they look like cigarettes, right? And they were sold by tobacco companies, and there actually were some clinical trials. The second generations were more like they were medium size. These are where you get the vape pens, and they have adjustable voltage. And remember, the thing about these cigarettes, okay, it's going to be regulated. That was just changed in the FDA, which is a huge victory. But generally, a lot of the nicotine a lot of them are made overseas. A lot of them these are not even sold by most of the major companies. There are a lot of little companies that have sprung up, but it is a huge industry. And then the last are the mods. You see these big sort of battery operated, the other ones that are like blowing up, the batteries and so forth. Supposedly, you can adjust all the voltage and the wattage. Imagine that, kids, right? Adjusting voltages, scary stuff. And that's why they're considered superior. But just so you know, a lot of kids will say, I don't smoke, I vape. They think it's water coming out. And the reality is the aerosols do contain heavy metals, ultrafine particulate and cancer-causing agents. And P.S., it still has nicotine in it. Even many of the ones that are marketed as not having nicotine, because they're not regulated yet, have nicotine. And supposedly August 16, they're going to implement that law. It's going to take a while, trust me. And there'll be a million, loopholes and so forth. So we still have to educate. It's highly addictive, and what's important to remember, a lot of the flavorings, it actually is the dangerous part, because a lot of things that are approved, it's called generally recognized as safe. Like cinnamon is an example. You can eat it. It's generally safe, but it's not approved for inhalation into your lung. And if you remember back, in the factories when they were making the popcorn, and it was like buttered popcorn, and people were getting lung disease from the butter flavoring, it's sort of, that's the same thing kind of happening with lung disease. And let's talk about the adolescent brain. The part of it, first of all, we have an adolescent brain, which we know doesn't even think about consequences or any of that till late 20s, right? If you study the adolescent brain, what's the part that develops first? Risk-taking behavior. Okay? And now you have nicotine, which can disrupt the formation of brain circuits that control attention, learning, and susceptibility, thank you, to addiction. Well, all of those things, let's face it, teenagers don't need any help with. I mean, that's, they're having problems with those things all on their own. So that's the real concern. And from my perspective, and a lot of people, we have to talk about little kids. All right? Very toxic. There's been deaths in New Jersey. The calls to the poison control centers are elevating, and these are the things that we need to be talking about. The reality, the facts, that really tell the story of the danger of a cartridge that is sweet-smelling and, cotton candy flavored, laying around because it looks like a pen, and kids, potentially ingesting it. They can get poison through absorption through the skin. And I'm not an expert on e-cigarettes, but I felt that this kind of information is just really helpful to people to know. So it's going to be regulated, hopefully, the nicotine concentration and the contents and so forth. The other thing is the marketing, and this is my issue. I do not argue, because there are clinicians who will say that e-cigarettes are better than smoking regular cigarettes. And you know what? If you're using them to cut down and eventually quit, I am not going to argue with you. But if you're using them to create a whole new generation of smokers in kids because they're not smoking cigarettes anymore, and trust me, that's what the tobacco companies are doing, then we have an issue in public health. And this is just some of the things they've done that is very, very, has been very successful in marketing cigarettes to youth. They throw in like candy. It's all rebellion and glamour. I was laughing because it says sex, liberty, endorsements. That's what happens when you change your slides at 12 o'clock. But it really is they use celebrities to endorse e-cigarettes because that's big with kids. And of course music, Water Tour and all those music things that your adolescents talk about. Okay, again, tripled the advertising, and right now they're not subject to bans. They are, you see them, and the kids have been exposed. Just look at how much money is being spent, on e-cigarettes. And then, of course, there's the fact that they might blow up. I heard one story where one blew up in a guy's pocket, and he did damage to his testicles, and I said, we need to put that on a poster. Just a little, this is the information we need to get to people, the rise in e-cigarette use, the fact that kids, 250,000 kids, middle and high school as well, that's 3 times as many than in 2011. And look at this slide. This slide, I think, is so telling. High school students, where we've decreased in cigarettes, we've more than increased that amount in e-cigarettes. I put the slide in about hookah more for your information. That's the water pipe. Again, toxins, extremely addictive. It contains all kinds of nasty stuff in it, just like, and carbon monoxide like a cigarette. What's important to understand about hookah, what do kids do? They go to hookah lounges, it sits on their, the college kids, it sits on their table and they smoke their hookah. A 45 to 60-minute session is like smoking 100 cigarettes, okay? Because the nicotine, they just put it in and it's strong. And of course we know they use it for other things. Our health educator told me a story today about an e-cigarette vape shop, and they said, well, marijuana is going to be legal soon, so we're going to be all ready because we got all the, So it's seen as an enterprise as well, and that's a problem, and you see the hookah bars and et cetera. And a lot of people really don't know, and that's where this vape campaign that Kevin saw that, encouraged him to include me today, people don't know that it is the law in New Jersey, and we have materials that I'm going to talk about this afternoon that reinforce that amongst different populations. That's everybody's hanging out vaping, new thing to do. So, as I said, municipalities have been doing a lot of that with age of sale and so forth. this partnership, and I think it's a perfect opportunity, that we, as was said before, we can tell the story. We can talk about the kids, and that's what we need to do. And that's what our ENDS, our campaign for ENDS does. We have posters, we have signs, we even have tabletop tents with the intention that in bars and restaurants they can be put there. We just did something with Burlington County College. We have an ENDS campaign with them, and they're going to be putting them on the tables all around the Union Building, these little tabletop tents. And the law is stated on the tent. One side says no vaping, no smoking. The other side has the law and nicotine, what happens with nicotine addiction. So we're doing all kinds of crazy stuff. I'll talk a little bit this afternoon, but advocating in an adolescent population today is no small feat. Their technology is changing faster than you can believe. And, I am far from a social media specialist. It was really funny. I keep saying, social media, it's for older people. And my media guy looked at me and said, how old are you? And I said, I'm going to be 59. And he said, do you use social media? I said, oh my God. That demographic's really changing. But we're doing things like Blogger. We have a Jimmy Fallon ad, a takeoff on Jimmy Fallon. BuzzFeed, what we're doing with BuzzFeed is we're developing a campaign, and it says, which Friends character are your vape habits most alike? Okay? And let's say it's Phoebe. You go in, and Phoebe says, ooh, even my smelly cat wouldn't vape, so that's how we get the information out. But you've got to use more creative ways to do it. And of course, community outreach is much of what we do. I'm almost done. This is Smoke Free Teen. So this is really interesting. One of the things, the government has some great websites, and kids don't use their phones to talk, so don't even bother calling. They just use them to text and access information. But Smoke Free Teen is not exactly a sexy, URL to encourage them. So we developed a URL called Don't Get Vaped In. And so you can use a port that takes them from Don't Get Vaped In right to the page in Smoke Free Teen that talks about electronic cigarettes. So that's sort of a sneaky little way to get their attention and hopefully do some education. And then once they go there, because there's not enough money to develop it on our own, there's texting programs, there's apps, there's games. So, utilize the dollars that are available in more creative ways because we don't have them, basically, is the message there. So, just wanted to put some quit line information. The quit line is still alive and well in New Jersey. It is still giving out nicotine replacement patches. We have a website, we have a Facebook page. So utilize the resources. Anyone who wants more information on resources on either our smoking cessation program, Mom's Quit Connection, or our general quit line, please, I'd be happy to talk to you. And that's it.
Good morning. How are you all doing? First of all, I want to thank Liz for mentioning my name to appear here today, and thank you, Kevin, for inviting me. I'm going to be brief. I'm going to do a wrap-up and try to intertwine some of my own experiences and as they relate to what the other speakers have already said. When we did our conference call planning for this session, we talked about how we want to divvy up things. I'm like, well, there's only a couple of hours, and it's so comprehensive. I'm listening to what each of the other presenters are going to do, and I said, why don't I just kind of do a recap? That way, it'll all be interesting from each speaker, and I'm allowed for some questioning. So that's what I'm going to do here today. First of all, I've been in this business of lobbying for just about 40 years. It's been a long road for me. When you start heading to 70 years old, it's kind of a milestone in life where you start thinking about what you want to be when you grow up. And I've had an opportunity to actually be a lot of things. So when Kevin said, well, we want to talk about advocating across sectors, I started thinking about my life, and I said, if I talk about that to the group, they'll think either I couldn't keep a job or, it's kind of fascinating when I look at sectors. I think I've been in almost all of them. But it's kind of fascinating because a lot of what I've done in life had to do with health care, but it wasn't always in the health care business. And that's the message that I want to leave with you today. When you start thinking about your own specific fields, your own titles, your own specialties, sometimes it's not always going to be about your agenda, but you've got to figure out how to partner and bring all these ends together so that it works for a common good. The many sectors that you're going to be competing with out there, we've already talked about being a registered law. After you show up. So that's one of the things that we've got to look at. Something that I learned when I was in the governor's office, when people would come in with a very legitimate concern about something we were going to do, and I'd run in and I'd say, well, we got to really look at this. We've got to change it. They said, well, let's look and see how much they contributed to the campaign last year. Oh, I don't know if we can do it that way, Janine. See if you can just kind of hold them off for maybe 90 days. Tell them that we're studying it. Tell them that we're studying it. And then we found legislators to blame it on. But you know what? If you have your own relationships, you can actually get your issues through the maze. Needle exchange. That was a tough issue. And one legislator, he kept saying, well, if you're going to do needle exchange, does it mean that you're promoting drug abuse? I won't even name him. He's a friend of mine. We couldn't get him off of that conversation. And he held it up for a long time because he came from the right city. He came from Newark. And other legislators were scared to death to take him on because of the high incidence of drug use up in Newark. He was supposed to be the expert, and then we finally got it through. The other thing that I wanted to point out to you, one of the hats that I wore was as a locally elected official, councilwoman. I served as a councilwoman for 12 years. And Assemblywoman Sumter, again, is a very good friend of mine, but let me just say something to you. If you are an official in a town or a city, and I see my own good friend Jim Brownie and neighbor and my health director at Trenton here, do not go to a legislator unless you talk to somebody within your town. You could find yourselves fired. Some of these things have consequences as you're advocating for something really, really good. Be very careful about how you reach out. The other thing within the organization of PHACE itself, it's funny, when I looked at the word PHACE, I kept saying, does this really phonetically say what it looks like it says? Because if it does, this is one of the best branding words anybody could have for an organization. PHACE. We are PHACE. We are the face. Think about how you're going to brand this organization. You're going to have folks who are a part of it where in some instances you're on opposite sides of an issue. You've got to realize that. That's one of the tough things about being part of a coalition, because not all of you have the same interest on every single issue. And that's okay. You make a decision, decide in advance what you're going to agree on, and what maybe you'll have to go your separate ways. I don't know if you have a logo yet. If you do have a logo, look at it and see what it says about you. If you don't have one, you need to develop one, because branding in this world is very, very, very important. I am a branding expert. I take people and help them develop their images, their company's images, their organizational images, and I tell you, it does matter. People laugh all the time when I walk into a room. You got a 66-year-old woman with a blonde mohawk who's very, very ethnic. This is who I am. Everybody, and I'm not even 5 feet tall. But I tell you, you go around the state and you ask folks, do you know Janine LaRue? All of them are going to have the same description of who I am. They're going to say she's very short, she wears ethnic hairstyles, she wears bold jewelry, and they'll say something about my diction. Because it's the brand that I've carried all of these years. So you've got to figure out as an organization, what's the brand you want to hold as you move forward. I understand that you haven't been together in a while, so you're just starting up again. This is terrific. And you need to really go out there in social media. Social media is the world, it is the way we are operating today, and it is the way we are communicating. It's not going anywhere. I'm on it all the time. My Facebook page, I've maxed out at 5,000 friends. I keep waiting for a person to leave me so that I can get another friend. I want to see who I'm going to put in. In closing, I just want to leave you with a quick story, and then we can have some questions. So that at the end of the day, we're in this business to change lives. And I learned about health care in my first year of working with the Barnabas system. Having served on hospital boards, I served many years on the Cooper Hospital Board of Trustees, but it all came very close to my heart in the first year that I worked at Barnabas. I got a phone call from the then, now deceased CEO of Newark Beth Israel. And he said, you know, I have a clerk here who has a daughter in a country in South America, and she just gave birth to her first grandchild, the clerk's first grandchild, and the baby was born with all the organs on the outside of her body. And I'm like, okay. Said, Janine, any way politically we can get this baby to America, because they don't have any really health care over there, and the baby is going to die in 4 days. In 4 days, everything will shut down. And I said, so let me get this right. You call me to see if we can work some magic to get a baby from South America over here in America to perform major surgery so that the baby can live. Are you serious, Paul? And he said, I'm serious. And if we're going to be a real player to save lives, every life matters, and this woman works for me in this hospital. So I went into my CEO, then Ron Del Moro, and I said to him, boss, we have a dilemma. And I tell him the story. And he said, is this a joke? And I said, no. He really does want us to use all of the muscle we have to see how we can make this happen. Fast forward. I called Donald Payne, Congressman. I said, Congressman, this woman comes from your town. She lives in Irvington. I don't know where we start, but is there a way you think that we can get this done? We need a plane. He said, you need a plane. I said, yeah, we need a plane to get the baby here because we don't have planes with the Barnabas system. He said, let me make some calls and see what I can do. I then called Senator Corzine. I said, we need special visas because apparently we're going to have to send a team of medical people on the plane to get this baby. And he said, Janine, I said, Senator, we really need to get this done within 4 days. Well, we couldn't get a plane from the military. I thought that's what we could do. But I remember Sharon Powell was on our board. They had a plane. And they said, you know, Janine, we'll let you guys use the plane for pro bono. Said the plane has to land a certain place, get your staff on it. I said there has to be specs so that the whole incubator can come into the plane. They measured it out. They said that will work. We got it all put together with a plane, with the staff, with the visa, and then to make sure that your people on the plane, their feet can't touch the dirt. So they got to very carefully slide that incubator in, because that's the only visa you have. And then the morning of the flight, I get a call, and the CEO called and said, everything is falling apart. Said because the doctor, who was a female, her husband had gone down on a plane several years before on this type of mission, and the kid said, please don't go, Mom. And she thought about it. Phone rang an hour later. She said, I'm going to roll the dice. I'm going to go. Folks, they brought this little girl in this incubator on a sharing plow plane, where a U.S. Senator got us a very special visa for everybody on the plane as long as their feet didn't touch the soil. And they flew this baby to North Beth Israel. And 2 years later, when the senator came to talk to our Healthy Hearts people, the nurse came up and said, could you bring him up to the children's section? The baby is going home next week. And I put him on the elevator. He didn't even know what he was going to see. And when he got on the elevator and the doors open, and he's in this neonatal area, and he said, is this the baby? I said, she's going home. At the end of the day, whether it's needle exchange, whether it's e-cigarettes, whether it's a virus that makes a difference in a pregnant woman, whether it's a child in another country where we can use our political muscle to save a life, at the end of the day, what it's all about, in this field, healthcare, we do what we can do to truly make a difference. Because the difference we make, it matters. It matters. Thank you.
So we have a few minutes. We can hold off lunch for a little bit, and Kevin McNally, President, New Jersey Public Health Association, and most of you, I think, know, former State Health Department employee, is going to facilitate this session for us. Thanks, Kevin.
The sound? Yeah, okay, now it's working. So I will leave this on the table for our panelists. So now we're wide open for questions. So who's got the first question for any of our panelists? Anybody? Yes, Mr. Pappenberg.
Yes, on the question of lobbying, suppose that I, as an individual, wanted to lobby some specific legislation and divorce myself from the association. Would there be any problems with that?
Again, I am not your attorney. So, activities that you engage in as a private citizen, as a constituent, are not covered. I mean, that's not considered lobbying. It's only if you are using grant dollars or federal dollars or acting in your capacity of your job where you can get yourself into trouble. But as a private citizen and a constituent, you're free to lobby as a citizen. Yeah.
Yes, and absolutely legally, that absolutely is true. Let me just say this to you, though. Depending on what the issue is, one of the things that a gentleman said to me when his father was teaching him to drive, he said, Dad, should I turn the lights on now because it was getting dusk? And his dad looked at him and said, if you have to ask, the answer is yes. There are some issues, even as an individual, you can go ahead and legally, you're okay. But depending on the legislator, who may be on the other side of that issue, they can sometimes make your life miserable. So I often tell folks, think about it long and hard before you step out there, if, because sometimes there are consequences.
And you have to use your home computer. Right, and you have to,
Yeah.
you have to use your home computer. You can't use anything that you developed at your job. And there is some gray area there. If you're testifying using your job-acquired expertise and knowledge, there might be some gray area there. If everybody knows who you are, that's so-and-so, he's the, head of the state health department, that there might be some problems there, so everyone is well educated.
So then a follow-up on that, as a private citizen, I can't go and do lobbying on my own and say, oh, by the way, I'm president of NJEHA, I can't mention that. What if the legislator knows I am in that position?
Activity that borders on lobbying is not being paid for with restricted funds. So if you're a coalition and there's some portion of it that's grant funded, or that's CDC grant funded, or that's subject to nonprofit lobbying restrictions, you just have to find another source of funding, so that if you're audited or you're questioned about it, you can say, no, we used this pot of money for the lobbying activity, which is not restricted. Oh, about volunteers. Volunteers, that's a tricky question. It depends on the volunteer. I'd have to look into that because I don't want to give you an answer in front of everybody that's not accurate. So let's talk after, and I'll research that for you. Sure.
Maybe I can expand on Tony's question a little bit, because usually I think what Tony's talking about is where you get funding for an activity which is being done by a coalition of organizations, but you have the funding only goes to the lead agency.
Right.
So do the federal restrictions then apply to everybody who's a participant in the coalition, or only to the lead agency, which is actually getting and using the funds?
That's a good question. If I had to answer on the spot, I would
Can you use the mic, please?
If forced to answer on the spot without doing any research on it, I would say that the restriction would apply to everybody,
Okay.
And not just the lead agency.
Mhm.
But that's the most cautious, lawyerly stance that I would just gravitate to, and then I would try to find loopholes. But I will research that for you and work with Kevin to figure out how to get the answer to you all.
Stephanie, I think you had your hand up? Yeah.
Right. Right. Right.
My question more specifically was, a lot of us may be like 501c4s, I think.
Okay.
Professional associations.
Yes.
So they're not. So are they working on the same restrictions as the 501c3? Is it true nonprofit charitable organizations?
They have their own IRC restrictions that we didn't get into today. They're similar. But there are allowable amounts of lobbying. I don't know what the percentage is. Like for a 501c3, it's 5% roughly is the baseline. 501c4s have a similar percentage of activities that's allowable for lobbying. It's not like the grant funding stuff where none of it is allowable. And as far as the coalitions go, I hear you. It's a big problem. But there's always some funding from somewhere that you can say we use this money. We ran into that same problem ourselves. I'm 100% grant funded by Robert Wood Johnson, and we had to bend over backwards to try to find a little pot of money from the University of Maryland Law School that I can say I worked under this when I went to Connecticut. There's always a way to wiggle around.
Okay. More questions? Over here. Yeah, Trevor.
Yeah, I'm not quite sure I understood the self-defense clause. Is that, no, assuming I don't, because I'm not sure if I understand it, so the question might not be correct, but can that be used to argue against unfunded mandates?
Oh, that's a great question. Oh. I know, I'm writing that one down for follow-up too. What a great question, because that's, I mean, obviously, unfunded mandates is a huge issue. Again, my cautious response would be no, that the self-defense is really intended more to, protect your job, not to prevent you from having to do more under your job without funding. So I would say that it probably doesn't fall under the self-defense exemption, but that is a very, very clever idea that I'm going to research and maybe blog about.
Okay, other questions? Over here. Let me ask one. Our organizations frequently get contacted by other organizations to participate in sign on to their letters to support a specific legislative proposal or oppose it. From the perspective of the representatives and their staff, how effective is a sign-on letter, is a letter on an issue from like a dozen organizations or 100 organizations vis-a-vis getting a dozen or 100 individual letters from those organizations?
Which there's kind of two things, I think, with this. There's both quantity,
Yes.
which can be very influential, right? If you have 15,000 people calling an office, or if you can get people to each individually send in a letter, the sheer quantity can make a difference. There's also the quality of the letter, and one really well-done letter signed on by 15 organizations, but there's also the quantity. How many organizations are signing on? How many individuals or subgroups do those organizations represent? And so I know NACHO, we sign on letters all the time, and so sometimes sign-on letters in and of themselves get press, and then you as a company, you can potentially even get quoted in whatever that, earnings is. And so, both work. So if you're, able to comment on a regulation, both the quality matters, but if you, as an organization, want to send in a coalition letter, and then each one of those organizations wants to send in their own letter, and then if those organizations have grassroots arm who can send in their comments, all good. All of the above.
I know in the governor's office, what's normally done, when letters come in and there are multi-organizations that have signed on, that's plugged into a database so that when the issue comes up for a veto or the governor signing the bill into law, they do look to see what other organizations either support it or oppose it. So it's very, very helpful. But I also caution organizations when you sign on to letters, make sure that you're looking at every version of the bill, because sometimes bills are amended, and what may have been important to you could have been amended out, and you're now signing on to a new concept. So make sure you know what you're signing in support of.
Okay. We have one last question out there from anyone? If not, can we have another round of applause for our panel? Thank you very much. Turn it back to Kevin.
And so thank you, our panelists. Thank you, Kevin, for moderating. It is lunchtime, but just very quickly, we will start again at 1 o'clock at the breakout sessions. The rooms are on the abbreviated bio sheet, and the topics are on the agenda, so hopefully you have both of those documents. CHES credits, I neglected to mention earlier, is a separate evaluation from the one that will go out electronically. Make sure you complete that and leave it with us today. And since there have been several mentions of social media today, I know that Lisa is walking around the room taking pictures We will post them on our association's website, but we'll make them available for anybody else who wants to post them on their Facebook pages, and we can start to connect those pieces together. Enjoy your lunch. See you this afternoon.
It's really cool.